Pulmonary hypertension is a serious, often progressive, and often fatal disease of the lungs. Typically, it's characterized by high blood pressure in the pulmonary arteries that feed the lungs. CTEPH, or CTEPH, chronic thromboembolic pulmonary hypertension, is one type of pulmonary hypertension. In some of our thinking, it's probably the most important kind of pulmonary hypertension to think about and diagnose. CTEPH typically arises in people who have had blood clots in the lung, also known as pulmonary embolism. Fortunately, most people who have pulmonary embolism don't develop CTEPH. Up to 4% of patients after a blood clot in the lungs can develop CTEPH, and then it's very much like other kinds of pulmonary hypertension. Patients are short of breath, tired, and then start to have syncope or loss of consciousness and chest pain. CTEPH is an important cause of pulmonary hypertension because it's one of the most curable causes. We have very exciting therapies, including surgical and now new medical therapies, that help many of these patients. One of the biggest challenges in diagnosing CTEPH is the symptoms patients experience are not specific just to CTEPH. And so the symptoms of shortness of breath, tiredness, swelling of the feet and ankles are seen in many other common diseases of the heart and lungs. For example, patients can have asthma and they can get short of breath. Patients with heart disease like heart failure get short of breath and swelling of the ankles. And so it's not surprising that many physicians will see somebody who's short of breath and think about other common diseases of the heart and lungs before they think of pulmonary hypertension. It is very important to think about PH or CTEPH in anybody that has those symptoms, even if it's non-specific. The most important thing we're going to accomplish today is that people are going to understand better this disease of pulmonary hypertension, and especially CTEPH, and how to help themselves get diagnosed sooner, quicker, better.